Now, physical discomforts of pregnancy, by and large, some of the most common ones that we see, of course, the nausea and vomiting, which is characteristic of the first trimester. And you will see questions about the patient complains of X, the patient complains of Y. What would you educate the patient to do? What would you have them to do? And so with nausea and vomiting in the first trimester, of course, smaller, frequent meals, eating crackers before they get out of bed, avoiding a lot of heavy liquids between meals, that kind of thing. Also, urinary tract is another one that's frequently seen on NCLEX about urinary frequency. We see it in the first trimester as the uterus is pressing onto the bladder when it hasn't risen up out of the pelvis yet. And again, in the third trimester, once the baby's head is engaged back down in the pelvis. So it will come, it will go away a while, and it'll come back. But the most important thing is to void when the urge hits, not to have urinary stasis to avoid urinary tract infection, wearing cotton underwear to avoid urinary tract. A pad is appropriate if there's leaking or incontinence, especially in the last trimester. And then with breast, in the first trimester, another likely question will be the assessment finding or the complaint by the patient of enlarging breast size, tingling, pain at the breast, and the intervention is to wear a good supportive bra to support those changes. Adaptations within the vagina that you would need to be aware of. Remember that in all of the trimesters, there's an increase in pH, which accentuates as a growth medium for bacteria, so the patient is more at risk for candida or yeast infection, so to report any itching or burning to their physician immediately for treatment, as well as, especially in the first trimester, changes in the epithelial lining will cause an increase in vaginal discharge, so frequent cleanliness, bathing with that, cotton underwear again. Douching is contraindicated in pregnancy, so not to do that. Then with adaptations to specific systems, if you want to look at it from not from a complaint standpoint, but as just system changes that would require probably anticipatory guidance or education as the patient is seen throughout the pregnancy. The respiratory system will increase in its volume, and as the uterus moves up, the diaphragm will be pushed up and the ribs will flare out, giving the patient a barrel-chested appearance, just as a COPD patient or emphysema patient. This is considered a normal finding in a pregnant woman. Oxygen consumption, it does not change the lung capacity, it just moves the shape. But the oxygen consumption does go up about 15%, and with hormonal changes, thought to be brought on by hormonal changes, nasal stuffiness, perhaps nosebleeds do occur, especially in the first trimester. So a cool mist vaporizer, perhaps a decongestant prescribed by the physician would be appropriate, or a saline nose spray would be okay. And then, of course, the dyspnea. This is a common complaint or occurrence, especially in the last trimester, where posture is difficult to maintain, sleeping in an upright position, just more rest periods, not exerting themselves overly a lot to decrease that dyspnea and that feeling of breathlessness.